The first thing you want to do in a foot reflexology session is introduce yourself to the feet. And that means putting your hands on the feet and noticing what are the colors of the feet, what's the size of the feet, are there any special things that you need to notice? For example, does the person have bunions or does the person have calluses? Bunions and calluses are all spiritual events in a person's life that have revealed themselves in the feet. And once you and you also need to find out what the temperature of the feet is. Are they cold? Are they hot? Are they stiff? Are the bones very tight? Are the bones loose? And then after you have introduced yourself to the feet, you want to take one foot and begin the warm-ups. And the warm-ups in a 1-hour session will run about 5 minutes. First thing you want to do in a foot reflexology session is introduce yourself to the feet. And that's just a process of finding out how your hands fit with the feet, whether the feet are stiff, whether they're hot, whether they're cold, whether they have calluses and bunions, whether you have hammer toes, whether the feet are flat, whether the arches are too high. All of these things that I have just described to you are events in a person's life which are reflecting themselves in the feet, which makes them a spiritual event. And so after you spend a few minutes introducing yourself to the feet, you want to take one foot and warm that foot up. So you're going to warm each foot up about 5 minutes in a 1-hour session. So if you're in a half-hour session, you might spend 3 or 4 minutes warming up the foot. And one of the really nice things that you can do to warm up the feet is to start by moving the different bones around. You can work on the metatarsal bones, you can work on the toes. Working the toes is very good because when you work the toes, you are not only bringing attention and focus to the toes, but you're also bringing attention and focus to the different body parts that are reflected in those toes, so that you're working the neck, you're working the eyes, you're working the hearing, you're working the sinuses, you're working the brain, and as you work the top of the great toe, you're working the face. And these things are all important because you need to let the foot know that it's going to receive a session and that it's going to enjoy what's happening to it in the next hour. And after you have done the toes and rotated the toes, then you may go down to the metatarsal area. You may go down to the ball of the foot and work the ball of the foot in rotations as well. Spreading open the metatarsal part of the foot in what we call a metatarsal fan. You're fanning out that part of the foot. You're opening that foot. And when you open that foot, you are allowing blood to go there. You're allowing lymph to start working in that area, which is a cleansing process. You're also allowing the bones to take a breather. You're allowing that foot to say, ah. And it's a really, really nice feeling. When a person is in a foot reflexology session and you begin working that foot, that person begins to go into a relaxation mode. And it's very interesting in reflexology because in massage, it may take several sessions before a person can go into a relaxation mode. But in a reflexology session, quite often it happens immediately. And of course, as the body begins to relax, and as the bones begin to relax, and the joints begin to relax, and the muscles and the tendons of the foot begin to relax, then your circulation improves and your blood pressure goes down. And it's also nice to take that opportunity at this time to rotate the entire foot on the ankle. one of the most important things that I think that I do in a reflexology session is rotate the ankle. When you rotate the ankle, you are going right to the heart of the spiritual center of your foot, which takes you forward in life. Because everything that happens in our lives happens in our feet. And this is reflected in the ankles. Ankles are very, very important. They're very spiritual. Ankles reflect themselves when the body needs a timeout. Quite often, a person will have a broken or sprained ankle, or a broken or sprained foot, and not even know how it happened or why. Just suddenly the person was taking a step and here was a broken bone or here was a sprained bone. This is your foot telling you and telling the world that you need a timeout. I'm reminded several years ago of a very famous person, Hillary Clinton, needing a timeout. And one of the things that happened to her was that she broke her elbow. She broke her shoulder, which was also a way of getting a timeout. And a lesser known but very famous woman, Sotomayor, was running for Supreme Court Justice. And you could tell as you watched her on television that she wanted to be the Supreme Court Justice, but she didn't want to go around and meet all those senators and congressmen, and she was dreading it, and she didn't like doing it at all. And it was going to take a whole week. And you could see by about the second day, things were really getting to be much for her. Sure enough, by the third day, she had her foot in a foot cast. The foot had said to her and to the world, Sonia Sotomayor, you're pushing things a little bit much here. So that's why we move the ankles around. We want to give them some special attention, special nurturing. We also want to know, are they stiff? Are they extra loose? Is either one of your ankles stuck in some way? Because you can find out a lot about a person's ankles through time if you will do ankle rotations before each reflexology session. Because through time, you will notice the ankles becoming softer and smoother, more open. And also, as you work these feet, as you warm up your feet, you also are offering a cleansing, a small cleansing, because any of the work that you do on these feet is moving the lymph around. And when you move the lymph around in a foot reflexology session, you are cleaning out toxins in the body, because the lymphatic system is your sewer system. So you're working on cleaning house is what you're doing when you start the reflexology session. And when you start working the toes, you're doing some very interesting things. For one thing, you're working the sinuses. And there are certain times of the year when the sinuses are just inundated with problems and they all start acting up. And this is a good time for a person to book a reflexology session. And if you are a person who has sinus issues, you may want to book your reflexology sessions about once a week, all year long. It takes a commitment because sinusitis and sinus afflictions are with us forever. So really, you can also get allergy shots, which I do, but I have supplemented the allergy shots with the sinus work on the reflexology work on the feet, because it really, really does help. And as you go along from toe to toe, you're going to come to the great toe, and that's where you're going to find your pituitary gland. And the pituitary gland is found in two places on the toe. A lot of foot reflexologists find the pituitary gland on the inner side of the toe, and a lot of foot reflexologists find it on the outer side of the toe. which is where I believe it is more often than not. And the pituitary gland is the mother gland. This is the gland that really controls and organizes and schedules everything that happens in the body. So working the pituitary gland now is a good thing to do. And of course, working the tips of your toes works the brain. And of course, everybody needs their brain work. So giving the tips of your toes some good attention is important. And as you work along, you're going to go and do the tips of your toes on all of the toes. And this is where you're going to look at the toes and you're going to notice, are these toes straight? Are these toes comfortable? Are they stiff? Does it look like any of the toes have been broken? Or do we have hammer toes? Do we have calluses? Do we have corns? Do we have any of these things on the toes? Because if you have calluses and corns, or if you have hammer toes, this is something that you, as a foot reflexologist, you're right there with it. You're working on these things with your hands. I always recommend that if a person has corns or calluses, that they go to the podiatrist to get them taken care of. And of course, nobody wants to go to the podiatrist. But experience has taught me that if you start trying to deal with corns and calluses on your own, you can end up with higher medical bills and worse problems than if you went ahead and went to the podiatrist right at the very beginning. So when you work the glands and you work the fatty part of the great toe, you are going to work the pituitary gland. And it's a very, very interesting thing about the pituitary gland. If you have a person that you have been asked to go and offer reflexology to, and that person says, "This is so painful, you cannot touch my feet," then it's generally because of the pituitary. And when a person is really sick, the pituitary does become agitated. It does have to work overtime, and so it becomes painful to the touch. I had one other experience that did not indicate that, but I think that the event that caused it was so traumatic. I had a client who never went to a doctor. She didn't have anything wrong with her. She was one of these people who's just fine the way she was, thank you. But she did come and get reflexology sessions. And she fell off of the ladder. And of course, ladder accidents are extremely difficult. So she ended up breaking the leg on one side and the arm on the other side. So she was in a mess. And she ended up in a hospital having everything set. And don't ask me why. I don't know what happened. I was not there. But whatever happened, she ended up 3 days later in Albany Med getting everything redone. Now this was a woman, I don't think she had insurance even. She didn't speak hospital. She had no physician. She hadn't been inside the doors of a hospital in probably decades. She was so far out of her element. And she finally got home, and she had to have a caregiver in to bathe and to cook for her because, you know, one hand worked and one foot worked and they weren't on the same side. It was really, really difficult. So I went to her house to offer her reflexology. I could barely touch her feet. And it could have been from the drugs. It could have been from the trauma of the fall. It could have been from the trauma of being in the hospital for a person who had real issues with being in a hospital. Whatever the reasons were, her feet were just almost untouchable. So when that happens, you go to the hands. the hands work out better if you can't touch the feet. It will also happen, your feet will be very difficult to touch if a person is having some kind of mental or emotional issues. Then you'll have a hard time touching their feet. But other than that, people are generally pretty willing to have their feet worked. And they not only are willing to have it done, they enjoy having it done. Now, one of the other things that you can do is you can go to the top of the toe below the nail. And that's where the mouth is and where the face is. The face is located on the top of the toe below the nail. And you can also, after you have worked the face, and that includes the mouth, the cheeks, that whole area. When you are through working the mouth and the face, you can go back to the toes and pinch the tissue at the base of each toe, so that you are pinching each toe right between the toes. There's an awful lot there. We have a class, I offer a class which I call a points class, which identifies literally hundreds of points that are in the feet which are healing. If you don't know what they are, one of the ways to recognize the points in a person's foot is just wherever there is an indentation. That's where there is something there that is a nerve ending for you. Now, so we have done the fatty parts of the toes, which is the sinuses. We've done the tops of the toes, which are the brain. We've gone down here and pinched where the toes come together. That's your lymphatic system, and the lymphatic system is located in other parts of the foot as well, but that's one part where it is located. And then we are also going to start working the toes down where they meet the feet, because when you get to the base of the toes, that's where the neck begins. And there are a lot of people who have neck issues. And of course the neck is the part of the body that holds stress. The neck and the hands hold stress more than any other body part. So that's what we're doing now, is working the necks. And also you're working the ears and you're working the eyes. The ears and eyes are found at the base of the toes where the foot meets the toe. And it's a ridge. We call it a healing ridge. And that's where you're working the eyes and the ears. Now the eyes and ears are very, very spiritual parts of your body, because hearing is extremely important, and your eyes are so spiritual. You know, we think that we see with our eyes, but we really don't see with our eyes. The light goes into the eye and goes to the back of the eye to where the brain is, and the brain filters what you have seen. And as we go through life, as we experience spiritual changes, our vision changes. I can remember several years ago, because I have some vision problems, and I went to see a physician, an eye physician, was in the waiting room, and I looked around the waiting room and I realized, it was a January, and I realized that everyone that was in that waiting room was in some kind of a coma. And I also realized that several of those people were not going to be with us in a few months. And you know, when you go through changes, then your vision changes. And all of these people had caregivers, and the caregivers had said, these glasses aren't working right. I'm going to take you to see the eye doctor. Well, you know, this is how it is. This is the natural way. When you begin to step into eternity, your vision reflects that. And of course, hearing is the same way. You know, we hear a lot of things. And when you don't hear things, it's frightening, as a matter of fact. I was recently in a cabin in Maine, and I walked out the door and it was completely silent. And I knew that there were a lot of animals out there because I was in the woods. And I also knew that I was new to this area. They had not smelled me before, and they were all on alert, so they weren't making any noise at all. It was very, very interesting. And you know, you can abuse your ears. A lot of people through noise just completely abuse their ears until they finally go deaf. And of course, that's happening more and more. And we all have these hearing aids now because we're old, and so you want to hear the birds singing. And we will notice that as you're working on these toes, that your client is becoming more and more relaxed. And that does happen. And they do quite often begin to snore. And they're not, it's different brain waves. I will not say that she's asleep, but I am saying that all of these muscles have relaxed. And she is in a different state. There's no question about it. And this is very typical in reflexology. It happens all the time. And when this happens at the end of a session and you finally get them up and you tap them on the shoulder and say, okay, it's all over now, you have to spend a few minutes with them and make sure that they get back in real time. Well, if not, they'll go out to the parking lot and get in the car and have a wreck, which has happened. I mean, I had one client who claimed that she was really okay. She went and got in her car and she couldn't get home. So, you know, this is how it works. So now the next thing we do is we are going to now work the what we call the metatarsal part of the foot, which is from the foot ridge down to the solar plexus. And so you begin by defining this area with the esophagus. And you work the esophagus down between the two toes, down to the next part of the foot down. That's absolutely. And then you're going to work the foot on both sides of the esophagus. And this is very interesting because this is from the solar plexus up to the neck, and this is where we hold all of our grief. This is where the lungs are, where the heart is. This is where people have asthma, where they have bronchitis, where they have COPD, where these are all grief issues. And it's very important to work those through all the time and realizing that many, many people who come to your table are grieving. No question about it, they're grieving. So what you want to do is also realize that the heart lies in the left foot. The reflex point of the heart is on the left foot and not on the right. And you're going to work both sides of the feet, and you are essentially working with grief. And if you have any issues, sometimes if people are still, if they're not asleep yet, they may tear up. They may remember things that cause them grief and cause them negative feelings. And if they feel comfortable, they will tear up. Now, I've gone through the many years, there have been several different ways that we deal with this. When I first started, if somebody teared up, first of all, you have to remember that when a person tears up, they're only doing it if they feel comfortable. If they don't feel comfortable, they're not going to shed any tears at all. Second of all, we started off with everything came to a halt, and you went and got tissue, and you hugged the person, and we don't do that anymore. Now, if somebody is tearing, you give them tissues and you just keep going. It is so normal. We have normalized tearing. And now, after we have done this, we're going to go down to the solar plexus. We're going to work the part of the foot from the solar plexus down to the waistline. And this is what we call the organic part of the foot. The organic part of the foot on the left foot includes the stomach, it includes the pancreas, it includes the spleen, it includes several different organs. And on the right foot, we have the liver and the gallbladder and part of the pancreas. And the liver is huge on the right foot. And the gallbladder is those are big. So if you come to the gallbladder point, then you rotate that gallbladder point with your thumb. Okay, so we're going to start on the organic part of the foot. And the organic part of the foot is the reflexes to the part of the body where the organs are. So most of the right foot is the liver, and then there's the gallbladder, which is a point, which is worse. And then the left foot has got the stomach and the spleen. And of course the spleen is on the left foot. It's a very, very important organ in the body that nobody ever knows anything about. And it's at least as important as all of the other organs that we talk about. So working the spleen is extremely important. And working the pancreas is extremely important because now with diabetes, everybody practically has diabetes. And that's where the pancreas is. So it's really important when you work the organic part of the foot. And when people get their feet worked regularly and they have diabetes, it does affect their numbers. There's no question about it. And the gallbladder, when the gallbladder has been removed, the foot, you feel like your thumb is going down into the china or something because your thumb just goes right into the foot because the gallbladder is not there. And most people have their spleens. You don't have to worry about that. Sometimes people used to have their spleens removed, but I haven't heard of anybody having a spleen removed in decades. Used to, as part of cancer treatment, people would get the spleens removed because the spleens produce the blood, and they would find that there would be a lot of cancer cells in the spleens themselves. You can live without the spleen, but it's easier on you if you have the spleen because that's where your red blood cells come from. And of course, then the heart is worked there and the stomach is there. You know, with a lot of people now getting bariatric surgery, that it's very important to work the stomach because the stomach is being radically changed surgically because people are so overweight and they are trying to bring themselves back to something approaching normalcy so that they can walk properly so that they won't have to have knee surgery, so that they won't have their diabetes anymore. So the bariatric surgery is becoming more and more common. I can remember one person getting bariatric surgery, and now at this moment I know 3 people that have got it scheduled this month, 3 people that I know, and I know another person who's in line waiting to have the surgery. It's getting to be a big business. So getting reflexology regularly and working the stomach, working the spleen, working your liver, working the pancreas, it's good for you. And then of course, once we have done all of the organic parts of the foot, then we go to the waistline and we start working from the waistline down to the bottom of the body, down to the base of the spine. And of course we do that when we go back and forth with across the large and small intestines. And of course, with the intestinal tract on the feet, you're working the different points. You've got some different points. You find the appendix, you find the hepatic flexure, you find a splenic flexure, you find the rectum, and you find all of these parts. Now, this is an important part of the body. When you start talking to people who have been receiving reflexology regularly for a long time, it's hard to find a person who has problems, digestive problems, who has constipation or diarrhea. And that's because regular reflexology sessions really promote normalization of your intestinal tract. And of course, what's normal and what's not? Well, what's normal is what feels normal to you. But what is not normal is having a lot of diarrhea and having constipation and having things that are very painful. So that is one thing that foot reflexology is very, very helpful for. And there are some children who, when it's time to potty train them, they just decide, well, they're not gonna go in the toilet. That's not going to happen. If you offer reflexology to those children regularly, they will go in the potty because they don't have any choice, they have to go. So, they don't have this obstipation anymore. But we do work these sessions back and forth. And I don't even ask my clients if they have problems with constipation or diarrhea. I know that 50% of them are going to have. That's just a given. And I don't ask them. I know I'm going to find out because several months down the path, they're going to say to me very quietly, I don't have that problem anymore. Well, I know you don't have that problem anymore, but I was waiting for you to tell me you don't have that problem anymore. It's a wonderful thing to happen, to be able to not worry about your lower and upper gastrointestinal system because it's working properly. And all with a reflexologist. It's amazing to me. It's kind of like a miracle, actually, I think. And that's a really good thing to have. Now you're down there, you're with the reflexes, you've got the rectum, you've got the appendix, you've got all these different points. You also have the bladder. Now the bladder is a very, very interesting part of the urinary system because it's very spiritual and at the same time very emotional. So that you have the bladder, then you have the urethra, which goes up to the kidney, and then you have the kidneys. And if a woman and a man, if a person has issues of intimacy, if things are moving in too close, too fast, if situations are being dealt with that he or she is not comfortable with, they're going to come down with bladder infections. They're going to come down with kidney infections. And When you have these issues, you must go to a physician. You need to get the medication because bladder infections can only get worse. They don't get better on their own. So you definitely need to go to a doctor, go somewhere and get medication for bladder infections. But you also have other problems with bladders. Women have muscles at the base of their pelvic floor that have weakened because of having children and because of other problems that they have in life. So when you work on them with reflexology, you help them support other things that are happening in their lives. This is true also of people who have issues in other things. For example, if a person comes down with cancer, when I first was getting a reflexology, my training was that we didn't touch anybody with cancer at all. That is not the case anymore. I went and trained at Memorial Sloan Kettering. If you have cancer, reflexology is wonderful. I need to take a break. I'm sorry. Sometimes your clients will come to you and they will have a serious disease. They will have cancer. They will have Parkinson's. They will have MS. They will have a serious disease. Other times they will come to you and then as time passes, they will realize that they have one of these diseases. Now, when I first started offering reflexology, the training was that we did not, if a person had cancer, we did not offer them any treatment anymore. That is no longer the case. The first time I ever learned, when it really hit home for me, and this was a time now when reflexologists did not offer any kind of therapy to a person with cancer. I had a client who had cancer and she said, I get my chemotherapy on Tuesday and I want you to give me a reflexology session every Wednesday or every Thursday because it is so terrible getting that chemotherapy. Well, nowadays the chemotherapy is totally different and it's not that difficult. But at that time I started giving her sessions and I wouldn't tell anybody because I was afraid I was going to end up in the slam. And that her doctor finally said that she told him, and he said, oh no, this is good because it runs the chemicals through the body much faster and you get a better treatment. And you know, she got well. And this was a time when people didn't get well from cancer. People died. So this was a wonderful thing to learn. So nowadays, if a person has cancer, if they're receiving chemotherapy, you give them reflexology, and if they're down at Memorial Sloan Kettering, all they have to do is ask, and a reflexologist will come and offer them the reflexology. So this is an important thing to know. And now we're going to go back to the bladders. You've got the bladder, you've got the urethra. And I've given you my warning about always going to the urologist if you have any problems. But then you get to the kidneys. You know, the kidneys are fascinating and they filter toxins and they are wonderful at what they do. And perching on top of each kidney is an adrenal gland. And the adrenal glands, people haven't paid that much attention to them, but we are coming to realize that the adrenal glands are very, very important. If your adrenal glands are fatigued and whose are not at this point in time, it's really hard to lose weight because your adrenal glands don't have the energy to fight the fat anymore. And so you need to get these adrenal glands worked in reflexology to give them a little bit of relaxation so they can do their job a little bit better. So it's an important thing. And then of course, after we've done the bladder and the urethra and the kidneys and the adrenal glands, we're going to go over to the spine. Now, there are several ways to work the spine, and one way to work the spine is to go up and down the spine with the fingers. And the spine is along the inside of the foot, and it's along the inside of both feet. And the other way is the Ayurvedic way with the heel of your palm. And I think that really gets in deeper, and it really does the job better. But it is how you work with it better, and always work the spine. If a person comes to you and they have back pain, it's very, very important to work those spines. And if you have a regular client who is suffering with spinal issues, you can pinpoint where that issue is on the foot, and you can work it specifically. So it's a very important thing. Spines, people think in foot reflexology, oh, well, she's got a backache, we're just going to work the whole foot. You want to work the whole foot, but you also want to find out which vertebrae and where is it on the foot. And it's also important, while you're doing this, to realize you're on the outside of the foot, you're doing the spine, but you're also going to go to the other side of the outside of the foot, and you're going to pinch it along the other side of the foot, and that is your lymphatic system. We pinched between the toes, and now we're going to pinch along the lymphatic system, and we're going to pinch along the outside of the foot. That is an extremely important thing, because when you work the lymphatic system, you are giving your body a cleanse. And having a clean lymphatic system is extremely important. And while we are talking about backaches, if a person comes to your table and you can tell by talking to this person that they really want to get back surgery, fine. Whatever it is that the person thinks is going to work for them is going to work for them. Backs are extremely spiritual, and they go with the flow. If your brain feels that you need back surgery, then that is what is going to work for you. So I whatever works for that person is what works for that person, and whatever doesn't, won't. So that's the wisdom of that. The other wisdom is that there are a whole selection of diseases out there that are chronic. Fibromyalgia, chronic fatigue syndrome, Parkinson's disease, multiple sclerosis. There's dozens of these diseases. And you should, if somebody comes to your table and they tell you that they've got MS or Parkinson's or whatever, try to talk them into 5 sessions just to begin with. It's going to take 5 sessions for them to really know how much better they are going to feel with reflexology, because reflexology shines when it comes to a chronic disease. It's wonderful, because people with MS and people with Parkinson's and people who have chronic diseases, it's very important that they receive reflexology. When my students go through the training class and they do their clinicals, I try to get them to work on 5, they have to do 100 sets of feet, and I try to get them to do 5 people that have a chronic illness, and to have each one of those 5 people come to them 5 times, because the 5 sessions and they see that it is better for them. Now, the next thing that we want to do, we've done pretty much the whole bottom of the feet. You've done the spine, you've done the lymphatics, you now want to work the top of the feet. So one of the things you can do when you work the top of the feet is go down the breast area, and this is between the bones and the toes. So you're going down between those bones and working that whole breast area. And that is such an important thing. It feels so wonderful to the feet. It's so, you could not ask for a better thing that you can do for a person to make them feel good. And you know, there are a lot of people who are in pain, people who have arthritis, people who have bursitis, people who have painful issues in their body, and they are chronic and they're not necessarily going to improve immediately. But regular reflexology can often make the quality of life definitely an improvement for them. So now I think it's time for to go to the warm down, in which you spend several minutes on each foot, warming down the foot and saying goodbye to the foot and allowing the foot to realize that it has been given a treat, that has been appreciated. You know, the feet are often not appreciated. I feel that sometimes when our feet have, for example, very high arches or very low arches, people are not comfortable with them, and they've given up trying to deal with it. And so here is this foot that is stressed no matter what, and with a reflexology session, life is better. I also feel that with reflexology you have an opportunity to relax in a way that you cannot any other way. And reflexology is a very easy way to offer a relief and offer therapy. You don't need an awful lot of fancy equipment. You just use your hands, and the person. Touch is an extremely important therapy in life, because in today's world, fewer and fewer people are touched in a positive way. When your client receives reflexology, if your client is also going to a chiropractor or an acupuncturist or a hypnotherapist or anything like that, if they'll book their sessions within 24 to 48 hours of yours, then you will be able to offer them an opportunity to experience synchronicity, because your session and that session so close together will equal 3 sessions. And thank you very, very much.